Good afternoon, everyone. My name is Lachi Mali, and my fellow member is Mohammad Ali Sabir. We worked on this project under the guidance of Professor Rama Srivastava. We embarked on an applied research project that explores a topic of profound relevance, that is, the impact of COVID 19 on accounting and finance students at Seneca Polytechnic. The COVID 19 pandemic changed the educational landscape dramatically, and the students in applied programs like ours face unique challenges. Our research seeks to the understanding these challenges from academic, psychological, and career perspectives. Today, we will walk you through our findings, methods, and recommendations for creating a more resilient educational environment. The image clearly illustrates that students experience stress both before and after the pandemic, highlighting the academic pressure is constant. However, it also reinforces a powerful message that despite of the challenges, the pursuit of learning never stops. Here's a quick look at the structure of our presentation. We will begin with an introduction to the research and its focus. Next, we will outline the research questions and objectives. Following that, we will dive into our methodology and hypothesis. We will then walk through the key findings from our data analysis, covering academic performance, mental health, career preparedness, and socio-economic disparities. Finally, we will conclude with a summary of our insights and offer actionable recommendations that aim to improve post pandemic educational outcomes. Let's begin with the background that motivated us for this study. Our research focuses on the multidimensional impact of COVID 19 on accounting and finance students at Seneca Polytechnic. This includes academic disruptions, mental health struggles, and uncertainties about the career progression. Our aim was not only to highlight the challenges but also to derive meaningful insights that educators and policymakers can use to build resilience into education system. This pandemic was more than a public health crisis. It was an educational disruption that exposed gaps and triggered a resistment of our learning models. As future professionals in the field that demands precision and practical skills, we were uniquely positioned to feel the shock waves. One of the most significant changes brought by the pandemic was the shift of emergency remote teaching. Unlike well planned online education, ERT was a rapid adaptation to an unforeseen crisis. For accounting and finance students, this shift meant losing access to in person simulations, labs, and internships, which are critical for skill development. At Seneca, students reported difficulty stating motivated to virtual classes and navigating platforms that weren't optimized for hands on learning. Many from low income households face technological barriers, unreliable internet, lack of quiet study spaces, or shared devices. These factors widened existing disparities and made the academic experience uneven across the study body. The this research was driven by the question, what is the impact of COVID-19 on the academic performance, mental health, and career preparedness of accounting and finance students at Seneca Polytechnic? To address this, we developed four main objectives: to assess the academic challenges caused by ERT and access to learning resources. Second is to examine the psychological impact, particularly stress, anxiety, and motivation. Third is to evaluate career readiness, including access to internships and job networks. Fourth is to develop recommendations that could support students in similar simulation in the future. These objectives provided a roadmap for our data collection and analysis. Our methodology was rooted in quantitative research using a cross sectional survey design. We collected data from 30 randomly selected students in accounting and finance program at Seneca Polytechnic. Ethical clearance was granted by the Seneca Research Ethics Board of Committee, ensuring that our process upheld privacy and informed consent. We conducted pilot testing with 15 students to refine our questions and validate our instrument. For data analysis, we used statistical models including the t-test, Fisher's excess test, Welch's t-test to examine relationship between variables like GPA, stress levels, and internship access. This allowed us to test our hypothesis rigorously and draw reliable conclusions to it. Now I would like to pass on to Mohammed for hypothesis.
Before I dive into the results, we established four sets of null and alternative hypotheses to guide our data analysis. These hypotheses covered the key focus areas of our research: academic performance, mental health, and career preparedness, and socioeconomic disparities. So our first hypothesis focuses on grade point average and emergency remote teaching engagement. Our null hypothesis states that there is no significant relationship between GPA and ERT. And an alternative hypothesis states there is a significant relationship between both of them. Our second hypothesis talks about mental health impact. The null hypothesis states there is no significant difference in student anxiety levels before and during the pandemic, and our alternative hypothesis states there is a significant increase in students' anxiety levels. Our third hypothesis states internship availability, and the null hypothesis says that the pandemic had no significant effect on students' ability to secure internships, as our alternative hypothesis states there was a significant impact. And lastly, our socioeconomic disparities talks about how the null hypothesis states that there's no significant difference in academic performance during ERT between students from different socioeconomic backgrounds, but our alternative hypothesis states there is a significant difference. These hypotheses allowed us to apply statistical testing rigorously and interpret our findings with greater clarity and confidence. So let's move on to our data analysis and results. Let's first start with ERT engagement and GPA. This slide focuses on the relationship between emergency remote teaching engagement and students' grade point average. Using a linear regression model, we found statistically significant negative correlation between ERT engagement and GPA. To break down, as GPA decreased, ERT engagement increased. This result suggests that students who were academically struggling tended to engage more with ERT resources such as online discussions boards, lecture recordings, and virtual office hours. There are two potential interpretations of this pattern. Lower performing students may have needed more help, prompting them to use more ERT resources in an effort to catch up. Alternatively, despite higher engagement, the remote learning tools may have not been effective enough for those already at risk academically. These findings challenge the assumption that more engagement always equals better performance. It may be due to the quality, design, and accessibility of remote resources played a critical role in their effectiveness. This study supports the need for institutions to rethink and evaluate how remote environments are built, ensuring that they truly meet students' diverse learning needs. Moving on to mental health impact. Mental health was another critical area of our analysis. We conducted a pair sample t-test to compare self-reported anxiety levels before the pandemic and during the pandemic. The results were both statistically and practically significant as anxiety levels increased distinctly during the pandemic. Students reported feeling more overwhelmed, isolated, and uncertain, and this is largely due to the sudden change in learning format, their loss in routine, and concerns about their health and future career prospects. This finding validates our second hypothesis and aligns with global research trends. The pandemic created an environment of high stress, especially for students who are already juggling academic, personal, and financial challenges. These findings underscore the urgent need for institutional mental health support, including accessible and destigmatized counseling services, mental health awareness campaigns, flexible academic policies like deadline extensions or pass-or-fail options. In short, prioritizing students' well-being is not optional, it's foundational to academic success, especially during times of disruptions. Moving on to impact on internship availability. Next, we will look at how pandemic affected students' access to internships, which are often essential for career readiness. Before the pandemic, 18 out of 30 students in our sample had secured internships. After the onset of the pandemic, the number dropped to just 5 students, a dramatic 72% decrease. While our statistical analysis did not detect a significant association, and this is likely due to our sample size, the real-world impact is undeniably severe. And this reminds us that statistical insignificance doesn't always mean practical insignificance. The loss of internship opportunities limits career exposures, weakens resumes, and adds stress to students navigating a competitive job market. And to address this issue, we recommend institutions to partner with employers, expand more career coaching and resume workshops, and offer a digital micro internship or job shadowing opportunities. These proactive steps can help students build their career readiness even in uncertain environments. And lastly, we'll move on to socioeconomic disparities. Lastly, we examined how socioeconomic status influenced students' academic experiences during the pandemic. Students were categorized in low SES and high SES groups based on factors such as income level, device accessibility, internet reliability, and household environment. Our analysis revealed a statistically significant decrease in academic performance between the two groups. Students with low SES backgrounds experienced a decline in GPA, and students with a high SES background saw a GPA increase. The average GPA difference between the groups were 1.71%. This highlights the unequal impact of ERT, where high SES students benefited from stable environments, dedicated workshops, and consistent internet access, while many low SES students faced the shared devices, financial strain, and limited academic support. The pandemic amplified existing inequalities, making clear that we must deliberate action to close the gap. Institutions can do that by providing loan laptops or having Wi-Fi hotspots, expanding the financial aid and bursaries, creating on-campus safe study zones even during remote semesters. And now moving to summary and conclusion. COVID-19 significantly disrupted the academic experience of accounting and finance students at Seneca. The shift to ERT negatively affected students' academic performance. Mental health deteriorated due to the increases stress and anxiety levels. Their career preparedness was significantly hindered, and their socio-economic disparity further amplified these challenges. And I'll pass on to Lachi to finish it off.
Thank you, Sabir. Now, based on our findings, we have something to propose for the recommendation, that is to adapt design educational systems that are adaptable for future disruptions by integrating hybrid learning models. Second is strengthen. Invest in mental health infrastructure offering accessible counseling and peer support. Third is to create and promote virtual internships and industry projects to maintain career momentum. Fourthly, to deliver technical and financial assistance, especially to the students from disadvantaged backgrounds. Implementing these measures can enhance student resilience and educational equity, making institutions a better prepared for whatever lies ahead.
I extend my deepest gratitude to Professor Rama for her invaluable mentorship and expertise, which guided the study design and analysis. And thank you for Lachi for her collaboration and tireless efforts in the data collection. And thank you to Seneca Business Delegate Ethics Review Committee for ensuring ethical rigor. And lastly, I want to thank Seneca's Polytechnic staff and students for fostering their academic excellence and generously contributing their experience. Thank you.